Hello everyone, this is imranbasha. Welcome to TCM with Imran. So I hope you are well and good. And today's topic is understanding of sciatica and its treatment in TCM protocol. So how acupuncture can treat sciatica and few exercise therapies also. And we're gonna discuss about how the sciatica comes and what is its origin and what are the reasons to cause the sciatica. So, what are its treatment protocol and clinical significance? So, basically, what is sciatica? Sciatica is nothing but it's a nerve actually. It's not a disease or disorder or anything. It's a lifestyle disorder. We can say lifestyle problem. So, if you're sitting for a prolonged time and you're standing for a long time, or any sudden physical exercises, you like imbalance, so this is leads to the sciatica nerve compression. So due to the disc also anything it can happen. So that is actually called as sciatica. The pain comes from the sciatica nerve. So it's actually irritation from the nerve and numbness also. Some kind of all those things comes in the sciatica through sciatica nerve itself. That is why it is called as sciatica. Sciatica is a pain that radiates along the sciatica nerve pathway. So basically, we have a long nerve in the posterior side of the gluteus muscles and inside the gluteus muscle from the lumbar region to foot. So we have a longish nerve. You can see here. It starts from the L4, L5, and S1, S2, S3. So generally, it is a thickest nerve in the body. So whenever the something it touches to the nerve, it starts radiating or pain or any irritation, burning sensation. So that is why it is a sciatica problem we call as. It is usually starts from the lower back and travels through the buttocks and extend down one or both legs. So we have two sciatica nerves, one each leg, each sciatica nerve we have generally. So it's not a disease, as I said, it's not any disease or something like that. It's a lifestyle problem, basically. So if you're sitting for a long time in computer, if you're standing doing any work, so that leads to the sciatica related problems. Its symptoms are common, severe common like back pain and leg numbness and irritation, burning sensation in the foot and anything. So that leads to the sciatica. This is the general meaning of sciatica. So anatomy of sciatica nerve is the sciatica nerve is the largest and longest nerve in the human body. As I said, this is one of the longest nerve in the body. So you can see here it starts from the sacral and this one lumbar region. I'll show you where exactly it starts and I'll explain you how the nerve originates from the body. Originates from the lumbar and sacral spinal nerves, that is L4, L4 to S3, and its pathway is lower back, buttocks, and back of thigh, and down to the foot. So this is general pathway, as you can remember. Whenever you have a irritation in backside, like gluteus muscles and hamstring muscles, or popliteal fossa and calf muscles, these muscles actually get irritation or burning sensation or some kind of mild pain. When it is severe cases, it leads to the severe irritation or burning sensation. So it radiates the nerve. So if you see some kind of symptoms in the body, that's generally a sciatica actually. You can see here how long the nerve is. It starts from sacral region and lumbar, and it's coming down here, and it passes through the calf muscles and till the down of the foot. So whenever the sciatica nerve affects, we get the burning sensation in the foot region also. Very important now. So how where exactly the sciatica spinal nerve starts from? This is a gray matter and white matter. These are the spinal nerves where it is actually the roots are originated. So we have a vertebrae, right? So in the vertebrae there are a vertebral foramen. So each foramen we have a one nerve is passing from one side to another side. That means if you see here, see here, this is a spinal cord, and these are the vertebrae, and L4, L5, S1, S2 and S3. Basically the sciatica nerve starts from the L4 to S3. So from L4 region to one branch is from L4 and another is branch is from L5 and S1, S2 and S3. These five nerves form a one nerve called sciatica nerve. So where exactly it starts? So this is a dorsal root and we have a ventral root. So these dorsal and ventral rami, which again it connected to each other, that is a spinal nerve, and it again it splits into two. That is a dorsal ramus again and ventral ramus again. So there is a splitting here. You can see these are the splittings. I'll mark here. This is the splitting. So this is a dorsal ramus and this is a ventral ramus. So the blue color, as you can see, this is a dorsal root and this is a ventral root. What exactly, where exactly it starts from? So anterior primary rami for L5, S1, S2 and S3. As you can see, I'll draw here. L4, L5, S1 and S2, S3. These five lines joins together and form one nerve. This is a green color, which is also called as ventral division. This is a ventral division, and this nerve is called tibial nerve. So this another nerve, this has a different set of connection. Like this is a dorsal division, that this dotted one, like I'll change the color, green color. So this dotted one from L4, from L5, S1, S2, it doesn't connect to the S3. So this four connection from the L4, L5, S2, S1, S2, and this is a dorsal division, and this is this lines, the flow of lines without the dots is ventral division. This dorsal division has a connection of L4, L5, S1, S2, four connection. This forms one nerve called common peroneal nerve. See, you can see here L4, L5, S1, S2. These are the four nerves, L1 and L4, L5, S1, S2, S3. Tibial nerve has a five nerve connections. So exactly it starts from here. So this dorsal thing is connected here, dorsal ramus, this ventral ramus, ventral division. So this is how the origin of sciatica nerve started. These two nerves form one together, and this is a very thickish nerve. That is why it is called as a thickish nerve in the body. This is a tibial nerve. This is a common peroneal nerve. These nerve form together, these two divisions, and form a one nerve called sciatica nerve. Where exactly it passes through, and as you can see, the previous image was same thing. These two things, tibial portion and fibular portions. This is the sciatica nerve, and inferior gluteal region where exactly the nerve branch is connected, and supergluteal region also, and the posterior femoral and pudendal nerve from S4. This is how exactly the nerve looks like, the origin looks like. Dorsal root entry, this is a gray matter and this is a white matter. Why exactly it is connected here? This is connection generally to the brain actually. What is the purpose of sciatica nerve? It gives the signal to the brain, that is any kind of sensation, and again from brain to this muscles and foot and all the for the motor movement and all, whatever you can touch and feel, the sensation, the pain, anything that passes through the dorsal horn and ventral horn, that leads to the signals, the impulses to the brain, the central nervous system. That is why it is connected to the spinal cord. So you can see the branches here where exactly it passes through. from L4, L5, S1, S2 and S3, and it passes posteriorly inferior to the piriformis muscle. It leaves the pelvis through the greater sciatica foramen and inferior to the piriformis muscle. This is a piriformis muscle. This is a very important muscle. Whatever, if this muscle is affected, the sciatica nerve gets like pinching sensation. Like this is also leads to the sciatica. So that is why you should not sit for a long time in the at the computer. If you are sitting for a working and for a long time for 4 hours, 5 hours like that, this piriformis muscle get affected, and it compress this sciatica nerve that leads to the sciatica pain also. So generally I can say this, how exactly the pathway is going. You know this these four these five nerves and again in together and form a sciatica nerve and form one thickish nerve, and it descends to downwards through the gluteus maximus and piriformis muscles. It comes down again, and again it divides some kind of nerves like inferior gemellus and quadratus femoris, and this semitendinous and semimembranous and long head of the bicep femoris. In this also we have separate branches again. So one is, we know the common peroneal nerve and the tibial nerve. So for the common peroneal nerve, the yellow one nerve, only one branch is connected here. So you can see here the short head of the bicep femoris, only one connection. That means one kind of nerve only connected to the muscles. But in this there are four kind of nerve branches are divided. One is semitendinosus and semimembranosus and long head of the bicep femoris and adductor magnus hamstring part. These are the hamstring muscles actually. These are the hamstring muscles and tibial nerve. So this is a piriformis muscle. Actually this is how it looks like. This is a thigh and this is a popliteal fossa, and this is a gluteus maximus muscles and gluteus. Roughly I draw here. This is the leg. As you can see, this is the leg, and this is a popliteal fossa, and this is a sciatica nerve. So where exactly this is spinal cord? You just imagine spinal cord, and this is how the vertebrae are. These are the vertebrae, and this is L4, L5, and S1. This is a sacrum. Sacrum is like this, and you can see the origin starts from the L4, L5, S1, S2, and S3, and form and combine one sciatica nerve and descends towards the piriformis muscle inferiorly and posteriorly. It joins together and descends downwards again. And these two nerves has a name called, one is common fibular nerve, one is tibial nerve. So till the foot is this one tibial nerve, till the foot it is coming here, calf muscles and soleus muscles and the foot region, it is divided like this. This is the tibial nerve, and this one is a common fibular nerve, outer part of the knee. So this is a knee, right? So it's splitting from the knee, outer border of the knee, it's connecting here. So that is how the branches starts from the L4 to till the foot. That is why it is a biggest nerve in the human body. What are the sciatica causes? Sciatica cause happens because of any condition that affect the sciatica nerve. It can also happen because of condition affecting any of the five spinal nerves that bundle to form the sciatica nerve. So conditions are normally herniated disc and degenerative disc diseases, or spinal stenosis, or foraminal stenosis, spondylolisthesis, or osteoarthritis, injuries, pregnancy, or anything. So not these are the general causes actually, like spinal stenosis I have said. So these are like piriformis syndrome also. Whenever there is a compression to the piriformis muscle, that leads to the compression to the nerve. It put pressure on the nerve that leads to the piriformis syndrome. You can read here, when the piriformis muscle become irritated or overused from the long sitting, running, trauma or imbalance. It tightens or swelling. This puts pressure on the sciatica nerve, cause pain, tingling or numbness that radiates from the buttock down and leg to the similar to sciatica. So this region where exactly the piriformis muscles are there. So basically we put pressure here whenever we are sitting there. So you can see here this person is sitting on the chair where exactly the pressure is getting here. He's putting the pressure here. So is sitting for 1 hour, 2 hour, it is okay. So prolonged sitting, like office people sitting for a 4 to 5 hours or 6 hours sometimes. So that leads to the put pressure on this nerve. That leads to the sciatica nerve problem. This is also one of the reason. So this is a general reasons where exactly the sciatica problems comes. So what are its symptoms normally? So generally symptoms have like pain. Sciatica pains happen because of pressure on the affected nerve. So that is normal pain we will be having. So most of the people describe that sciatica pain has a burning or like an electric shock. This pain also often shoots or radiates down the legs on the affected side. Pain is commonly happens with the coughing and sneezing and bending or lifting your legs upwards when lying on your back. So when you sneeze or you cough, sometimes it affects the sciatica nerve. That means we do some kind of movement, right? So at that time it will, when the sciatica have a severe case, at that time this thing will happen. So tingling and pinning and needles, like tingling or pins of the needles, this is similar to the feeling you have a leg falls asleep because you sat cross-legged. That means the due to the poor blood circulation, the your leg gets numbness, like any kind of like similar to feeling the pins and needles are pinching to your muscles, some kind of tingling sensation. Numbness, you know, this numbness sensation, we don't feel any kind of sensation on the muscles. That is also a kind of symptom. And muscle weakness, severe, this is a more severe symptom. It means the muscle command signals are having trouble to reaching their destination in destination to the spinal cord. That is a different condition. So these are the similar common symptoms you can see. So can we treat through the TCM concept? So what exactly the TCM is saying about the sciatica? For example, the B syndrome, the painful obstructive syndrome, that means any kind of pain in the body, joints pain or any muscular pain, that leads to the B syndrome, the painful obstruction, any kind of obstruction in the chi stagnation we can say. So any the meridian doesn't flow properly, or it attacked by the wind or dampness, that leads to the painful obstruction syndrome. And disorder of the bladder meridian of the foot thigh yang. Foot thigh yang meridian is UB meridian. So where the UB meridian passes there, from lumbar to UB67, the sciatica nerve also is passing the same region. So we can treat through the this one UB meridian also we can treat. So what are the points we can treat, that I'll tell you. So the TCM pathogens, according to TCM, pain and numbness along the sciatica pain occur when the chi and the blood does not flow to the meridian. As I said, when there is a no blood in the there is no chi in the meridian. So what the meridian needs actually, that we need the chi. So energy come from the blood. That means the blood generates the chi. The chi is commander of the blood. That means we need both the things. If there is any stagnation due to the wind, cold or dampness, that means the meridian is getting affected. According to the TCM, we have to flow, the flow of chi is imbalanced. That time the person is getting pain or any numbness or any kind of pathogenesis that leads to the any kind of pain related problem. That is a B syndrome. So we can use some kind of points for that to flow freely the chi. So that uh, these are the meridians, like Taeyang meridian, gallbladder meridian, GB meridian. So these two meridian also affected, especially the bladder meridian. So we can treat through the gallbladder meridian also. Sometimes DU meridian also involved in chronic or deeper cases, because the spinal cord is there in the medial side, that is a the midway, the where the exactly the spinal cord is there, the midline, the spinal cord is passes there. So through the spinal cord only the nerve roots are originated. That is why the DU meridian also involved here. So we can treat through the DU meridian also. For example, DU4 or DU3 and DU5 also we can apply the needle. These are the general points where we can use in TCM. So TCM says apply affected meridian. So treat to the affected meridian or coupled meridian. According to the TAN's balance method, you can treat to the branching meridian or branching channel meridian, or system 1. You can use the system 1 like SI meridian. So we can, if we can to treat to the opposite meridian also, we can rectify the problem. So especially bladder 23, bladder 25, bladder 40 and GB30, these are the points generally we use to the sciatica problem. And bladder 36 for some supplementary points like Ashi points, and bladder 40, LI11. These are general points. So what I suggest is you can start with the bloodletting therapy, that means hijama or any you can remove some kind of toxic blood from the region where exactly the pain is there. So you can start with that. For example, if the pain is here, so especially the pain starts from the here, but the pain most of the time will be here, like burning sensation starts from here, this region. So these muscles, the gluteus muscles, where exactly the piriformis muscles are there. So you just do the dry cupping or wet cupping here, or you just apply GB30 here, GB30. So at this UB40, this one 23 and 24 or 22 also sometimes, and apply DU4 or DU3, the mid region, and GB31, and you can do cupping here also, hamstring muscles. Just do bloodletting therapy here, and you can do here also UB40 region, both the side. You can start with the hijama or wet cupping therapy, and again the next after few sittings you can use those points like UB40 and GB31 and GB30 and UB40, bladder 40, K3, UB60 and liver 3, and you can use DU3 and also, and use SI3 and SI3 also. SI3 is connected to the neck and shoulder region, then too you can use SI3. So that is how you can treat the acupuncture points for sciatica through acupuncture. You can use the moxa therapy also at the bladder 23, 25 and bladder 40 and K3 region. So you can regulate the chi, and it leads to the flow of energy in the body, so the meridian gets activated. That is how the chi floats inside the meridians. And you can do some exercises like lifting the legs and some kind of yoga asanas. You can apply the pelvic tilt and lie on your back with the knees bent, and flatten your low back by tightening your abdominal muscles for 5 seconds or 10 minutes, and knee to chest stretch and piriformis stretch and seated spinal stretch. These kind of some kind of cat or cow stretch. So some kind of exercise you must do the exercise. That is how, if any kind of disc bulge is there or any piriformis syndrome is there, that exactly the problem, right? So that is how we have to solve the problem from the lifestyle disorder, from the lifestyle routine. We have to rectify the problem. So that is how we can treat the sciatica problem. So I hope you are understanding, guys, and thank you for your patience, and see you next time. Thank you.